mental health recovery expert with Bill MacPhee. Hi, I'm your host, Bill MacPhee. Today we're going to talk about bipolar illness, bipolar disorder, or some people even call it bipolar syndrome. Anyways, what we're going to talk about today is some of the types of bipolar, which are bipolar 1, bipolar 2, and you also have recycling bipolar. As you know, my name is Bill MacPhee, and I'm a mental health recovery expert. I was diagnosed with schizophrenia in 1987. I was hospitalized 6 different times, lived in 3 different group homes, had a suicide, and was very, very um, sick. Today, I'm well. I have my own business. I am married. I have 3 children, and I am considered recovered. And my definition of recovery is when you wouldn't want to be anybody else but who you are today. And that's the definition of recovery, not only for people with mental illness, but people in general. So let's go on. So bipolar. So basically, I grew up with my mother who was bipolar. Actually, back then it was called manic depressive. And my mother would every little while she'd be in and out of hospital. She'd be in a hospital every couple of years, and we'd always see signs coming up. She would say that my cheeks are getting puffy, or my face is puffy, and as soon as that started, we knew mom was starting to get sick. And when she was manic, she basically had an elevated courage, elevated boldness that wasn't there in her natural personality. She would get in fights with people. She'd walk around the block and look into people's uh, windows. She'd just act out a character. She'd be very, her sleeping patterns would not be there. She would clear sleep, lots of energy, up very early in the morning, house cleaning all the time, nonstop house cleaning. And so that was called, now that manic depressive is called bipolar. And bipolar 1 is basically when you have manic states where you're up and you're going and you're manic. And a lot of times people with bipolar 1 don't realize that they're bipolar and they don't recognize that something is wrong or something is different. That's when there has to be outside intervention. So bipolar 1 is you're very manic, you're very high, lots of energy, out of character for yourself, elevated courage. You may be spending more money. You may think you have delusions where you think you have lots of money or you have special powers or something. So that's bipolar 1. Bipolar 2 is more of the depressive symptoms where people may not, with bipolar 2, may not have the mania, but they will have um, the depression sort of thing. That, and also lack of self-esteem may sit in, a worthlessness, all the symptoms of depression. Then you have what's known as rapid recycling, rapid cycling bipolar, and that's basically where you're very high and then you're depressed. You're very high and then you're depressed, and you may have bouts of that, maybe say 4 times within a year. If you have that 4 times within a year, then that's known as rapid cycling bipolar. Bipolar is very common. It's probably about 3% of the population, and some people with bipolar recognize that they have an illness, and some people don't, because of the fact that when they are manic, that they feel good and they think everything is fine. My mother way back used to be treated with lithium. Lithium is a drug for bipolar, and it was known as the golden standard, and it was very, very effective. In fact, it was classed as a miracle drug. It does really, really well. And if you ever seen anybody who is bipolar, who's been off medication and on medication, you will see a world of difference. Other medications that are used for bipolar are other ones such as the antipsychotics. You may have olanzapine, or which is Zyprexa, or Seroquel, quetiapine, could be treated treating for bipolar. Maybe Seroquel, different things like that. Or still the old standard of lithium is still a very good drug. Um, Manic depressive or bipolar people, sometimes they realize that they're ill and sometimes they don't. However, a lot of times, unlike schizophrenia, people with bipolar can be very, very high functioning, and can go around and not know, people may not know that they have So anyways, that's a little bit about bipolar. Next time on Recovery Blog, the Mental Health Recovery Blog with Phil MacPhee, we're going to talk about depression. So come back, check out our website, philmcphee.ca, or the other one, mentalwellnesstoday.com. You can find our publications at Said Magazine on there, as well as Anchor Conquering Depression. And remember, recovery is when you wouldn't want to be